MRI is useful because MRI is non-invasive. It can find tumors that are very small, but it's kind of expensive and it's not widely recommended at this moment in time, but it can be useful. So myself, I get an MRI as a screening tool once or twice a year for myself, just as a screening tool after age 50. At age 50 I said, no mammograms for me, and I managed to have a medical doctor order the MRIs.
Wow, okay.
Yeah, and ultrasound will show a cyst, and it might show cancer, but it's not a definitive technique. But ultrasound combined with fine needle aspiration is fairly good. So what women need to know is if there's any lump present, if they feel any lump, they need to persist with diagnostic techniques until they're 100% sure what that lump is.
That's right.
100% sure. And that might mean doing an ultrasound, then a mammogram, then an MRI, and then a fine needle aspiration, or a different order, but all of those, to know exactly what's going on. Because many times I have met women or treated women who for 2 years or 3 years were told that the lump was benign, and it was never aspirated, or they never had an MRI, or there was never a biopsy, and it turned out that it had been cancer for 2 years. You know? So it's a difficult thing. In the future, there exists now 9 separate blood tests, and I have this research on the MammaLab website. If we were to do 9 blood tests for every woman, all those 9 blood tests together would show over 90% who had breast cancer and who didn't. Totally non-invasive, but they're not available yet to the public.
Okay, so
and just think what that would do to the whole other diagnostic industry that's set up. You know,
it wouldn't
fly.
No,
it would take decades to shift that around because so much money is invested in mammography, right?
Oh.
But there are 9 simple blood tests that could be used to 90% of the time diagnose breast cancer already. So I'm thinking that in the future we'll have something like that, but it'll take a lot of change in the whole medical system for that to happen.
Okay. Well, we're not there yet.
We're not there yet.
Okay.
I wish we were.
That was coming from your book, Dr. Weston Price.
Yes.
You know, the research that he's done in
Yes.
was it 19? Yeah, in the 1900s. What was
1930s or 40s, I think it was. But
yeah, so he
Yeah.
did. So he traveled around the world,
yes,
and he studied healthy culture.
right.
And so what he noticed, like he studied the teeth. He was an orthodontist, I believe.
He was a dentist.
That's
He
right.
was a dentist.
Yeah. And so, can we talk about that?
Sure. So he studied the cultures that had the healthiest teeth and then looked at their diets to see what they were eating. And obviously he saw that the people with the healthiest teeth didn't eat any sugar.
Yeah.
And they ate just natural food, like fruits and vegetables and whole grains and beans, and they ate meat as well. So that was one thing, is that no refined carbohydrates, no sugar created the healthiest teeth. But then he started investigating cancer. And when somebody had cancer, he would remove a tooth. I don't know how he got onto the teeth thing. And he would implant the tooth under the skin of, I don't know if it was a rat or a mouse, but a rodent. And the rodent developed the same cancer as the person had. So he made the connection between infection from the teeth and cancer. And he did that hundreds of times or thousands of times. I can't remember, but he proved it over and over and over and again. And he was definitely a pioneer in that field. And so there is a strong link between infection, which creates chronic inflammation, and breast cancer, and many cancers. So we know that H. pylori in the stomach creates stomach cancer. We know that the human papillomavirus around the cervix creates cervical cancer. So we already know that several cancers are related to certain organisms. And my belief is that there's several organisms that can be related to breast cancer. There was a study done in South America that showed that the Epstein-Barr virus, how common is that, was present in 30% of all breast cancer tumors and not present in benign breast lump tumors, benign breast tumors, but present in 30% of all breast cancer tumors. There's another virus that's common in some European countries called the mouse mammary virus. It's also present in some women with breast cancer. So there's a link, And where do we get most of that infection? From our teeth. So if you have a root canal, if you had a tooth pulled, if you have very bad gums, there's likely organisms there that can get into the bloodstream, into the lymphatic system, and set up this chronic inflammation. And then these organisms possibly can get inside the breast cell, a healthy breast cell, and turn off the mechanism that would cause that breast cell to self-destruct and cause mutations in the breast cell to push it towards being cancerous, step by step. And so that's a whole other theory of cancer that's gaining more popularity now, but certainly was popular in around the 1950s, 1960s. But instead, research didn't go into that infectious cause of cancer, but it went into drugs. So there was a choice at that time in medical history where to put money.
So they went.
And it went into the drug industry rather than into researching infection and cancer. And it's only now that we're going back to it. So in the first visit, when I see any woman with breast cancer, I always look in her mouth. I say, okay, we have to get rid of the mercury, because the mercury also acts like the hormone estrogen. You don't want to replace it with plastic, because the plastic contains bisphenol A and that's estrogenic, so we have to use porcelain for now until we have something better. And then I look to see where the root canals are, or where the teeth have been pulled, and send her to just a handful of dentists that are able to test to see where there's infection in the mouth. They won't show up often on an x-ray. That's the hard part, because they don't believe it. You know, the dentists don't believe it. Because
so unless you have gums disease, or that's the only
right.
way you can notice.
Well, there's another technique called a cavitat, which is an ultrasound of the jawbone, and that will show where there's infection and erosion in the jawbone caused by organisms that have been there for a long time, and then we've got to clean that up. And then some other dentists use a CT scan of the mouth. That's radiation, but they use a CT scan of the mouth to find that infection that's hiding. But interestingly enough, almost all the time, I send a woman to say, pull that tooth. I use muscle testing. I just go like this, you know, is the arm strong or is the arm weak? When I place it over the root canal, and if it shows that the arm goes weak when they have their finger over the root canal, then I send them to the dentist to check it out further, you know, to one of the few dentists that can evaluate that. But then when they go back and have the tooth pulled, the dentist is usually shocked that there was so much infection that he didn't see on the x-ray in that tooth. So it's profound. It's profound.
Just with the muscle testing.
Just with the muscle testing, that's the first guide, and then I like to prove it scientifically with some of the other imaging, but it pays off.
This is so fascinating. There's so much I'm sure we could go on for another few hours here,
sure.
And you're very busy, so I won't take too much of your time. But Dr. Kaur, there's in your book, there's probably every page there's facts and also prevention.
Right.
Little tip, and this one on page 281, prevention. Here's what you said: strive to live a life in alignment with your true nature. When your passion and joy are kindled, and you use your talent and gift. Meaning that it's important to find the passion in what our purpose is in life, because many, like that was in your book, that many of breast cancer diagnosed, women that were diagnosed with breast cancer, there was old issue, unfulfilled.
Yes.
So can we talk about that?
Yeah, that's really important. Thanks for bringing that up.